What if one of the biggest missed opportunities in cancer was sitting on a pharmacy shelf? What if some of the most meaningful cancer signals weren't coming from billion-dollar drugs, but from medications that have existed for decades? And what if they were ignored because no one could profit enough to care? Hello, I am Dr. K. Paul Stoller, and I have a webinar detailing an alternative protocol for treating cancer at KennethStollerMD.com. But let's be honest, cancer treatment is still defined by the trinity of cut, poison, and burn with great toxicity, enormous cost, and recurrence that too often follows remission. Patients endure chemotherapy, radiation, surgery, only to be told,
"We'll monitor and wait."
And for many, that wait ends badly. I have had a protocol list of interventions that my patients have used, including 2 inexpensive, decades-old anti-parasitic drugs, ivermectin and mebendazole, not originally designed for cancer, but increasingly investigated for effects on tumor biology. And now, for the first time, a large prospective real-world clinical program has reported results that are impossible to ignore. Researchers followed 197 cancer patients, with 122 completing 6-month follow-up. This was not a niche group. Patients included prostate, breast, lung, colon, and many others. Many were already progressing, previously treated, or dealing with complex disease. And at 6 months, the results were striking. 32.8% reported no evidence of disease. 15.6% reported tumor regression. 36.1% reported stable disease. That's an 84.4% clinical benefit ratio, meaning more than 4 out of 5 patients reported either improvement or stabilization. Let's put that in perspective. If these numbers came from a new biotech drug, a patented infusion, a billion-dollar trial, there would be headlines. Investor calls. Fast track status. Instead, these are low-cost, repurposed drugs, which raises an uncomfortable question. How many meaningful signals in medicine have been ignored because there was no financial engine behind them? Now, this was a prospective observational clinical program, not a randomized controlled trial. Patients were also using chemotherapy, radiation, surgery supplements, so this does not mean these drugs cure cancer, but it does mean a signal this large demands serious investigation. Because cancer care should not only ask, how do we kill the tumor? It should ask, what safe, low-toxicity tools might help patients live longer, respond better, or buy more time? And if affordable options can help, even as adjuncts, patients deserve to know. Unless you are the medical cartel who just wants you to pay as much as you can while you are dying, even though they know there are much more efficacious alternatives.
In my webinar, I break down and how these compounds fit into a comprehensive alternative strategy. If you or someone you love is facing cancer, you deserve more than a one-track conversation. You deserve to understand. The question isn't whether this replaces cut, poison, and burn. Why wasn't it studied sooner? Well, we all know the answer to that. There is no money in the cure. To learn more, go to KENNETHSTOLLERMD.com and check out my webinar.